Hi everyone, my name is Whitney and I am a dental hygienist. If you're new here, welcome. If you've been here before, welcome back. Let's talk about teeth grinding and clenching. And before we jump in, I'd like to quickly remind you about my website, teethtalkgirl.com. If you're ever looking for a specific dental topic, I have a search bar where you can easily find what you're looking for. And also my Instagram, @teethtalkgirl. In the medical and dental world, clenching and grinding your teeth is also known as bruxism. Chronic teeth bruxism, or bruxing, can lead to excess pressure and overuse of your TMJ on either side of your mouth. Ultimately, all of that tension from biting so hard can strain the ligaments and muscles that allow your TMJ to move, aka causing you jaw pain, which leads to facial pain and headaches. Clenching and grinding, or bruxing, can also wear away your tooth enamel over time, which isn't good because enamel doesn't grow back. So how do we stop ourselves from doing this? During the day, if you're doing it, maybe you can catch yourself if you consciously try to watch for it. It's kind of similar to when you're trying to catch yourself slouching, like not sitting up straight at your computer desk. Same thing with your jaw. You might notice yourself clenching down hard when you're working. Try not to. That's the simple fix for it, is once you're aware, stop. But interestingly enough, most people who grind their teeth and clench their jaw are unable to be aware that they're doing it because they're doing it when they are sleeping. When you are sleeping, you are not conscious of what's going on, so you can't just tell yourself to stop. Sleep bruxism is considered a sleep-related movement disorder. People who clench or grind their teeth during their sleep are more likely to have other sleep disorders as well, such as snoring and pauses in your breathing or sleep apnea. So having said that, if your sleep partner or yourself have noticed that you are clenching or grinding at night, be sure to mention it to your dentist at your next dental appointment. Sometimes others who are sleeping near you will hear you grinding, which will help you recognize it, right? But if you are only clenching your jaw and not grinding your teeth, oftentimes you are the only one who is able to try and recognize it. Other than your dentist might notice tooth wear or recession. Other symptoms that might help you figure out if you're clenching or grinding your teeth at night may include pain in your jaw when you wake up, tired or sore jaw muscles, flattened, fractured, chipped, or loose teeth, worn tooth enamel, increased teeth sensitivity, neck pain, headaches, pain that resembles an earache, and cut up insides of your cheeks from biting. Again, please remember that you may have sleep bruxism and still not notice any of these symptoms until complications develop. So it's super important to seek regular dental care so your dental provider can monitor your mouth routinely and clue you in if they notice any of these signs or symptoms in your mouth. What complications can happen? Well, damage to your teeth, cracks and chips, which can lead to needing fillings, crowns, and sometimes even root canals, which can get expensive. Headaches that ruin your quality of life, severe facial or jaw pain, again, disturbing your daily life, and TMJ disorder. You might notice clicking or popping when you open and close your mouth. And lastly, why does this happen? Why are we clenching and grinding? Unfortunately, we don't 100% understand what causes bruxism yet, but research shows it may be a combination of things including stress. That's the big one across the board. Other emotions such as anger, frustration, or tension, coping strategies, or a habit during deep concentration, personality types that are aggressive, competitive, or hyperactive, genetics. Sleep bruxism, specifically, tends to occur in families. Bruxism can also be associated with some mental health and medical disorders such as Parkinson's disease, dementia, GERD, epilepsy, night terrors, ADHD, and sleep-related disorders like sleep apnea. Now, sleep apnea is a big hot topic of dentistry right now because sometimes the first hint of undiagnosed obstructive sleep apnea can be from your dentist visit, because people with sleep apnea experience some of the same warning signs and are often known to clench their jaws or grind their teeth at night. So please keep in mind that sleep apnea is a serious thing. So if your dentist has any reason to believe you might have sleep apnea, go get a sleep test. Now, how do we stop clenching and grinding? What's the best treatment? Finding out the root cause of bruxing is generally the best way to find the best treatment. For example, if you're bruxing due to stress is your root cause, stress reduction techniques may be what you need. Cognitive behavioral therapy is a thing, and so is sleep hygiene. And my best advice is to consult your physician or therapist if you'd like to learn more about stress management. So until you can get the clenching and grinding under control, as a dental professional, I care a lot about preventing you from grinding down your own teeth. So I highly suggest for all of my patients that are bruxing at night to wear a night guard to protect your teeth and jaw. I do have a video all about night guards and how they work and how to pick one. If you'd like to learn more, I'll link that video in the bottom bar below. In conclusion, if you're awake when you're bruxing, do your best to keep reminding yourself to stop. Get out of the habit. And if you're asleep, try to find out the root cause to help fix it. And until then, protect your teeth and jaw by wearing a night guard. Pro tip, if you notice yourself clenching a lot during the workday, consider wearing your night guard during the day too, if your line of work allows it, right? If you're not talking to people all day, if you're on the computer or something, it can't hurt to wear it. Your teeth will thank you. I hope this video helped you. Please like and subscribe if it did. And like I said, if you want to learn more about night guards and bruxism, I'll link my other TMJ videos and my night guard video in the bottom bar below. Peace, love, and teeth.